Good evening and welcome to tonight's forum for the 8th Congressional District Democratic primary with Congressman Stephen Lynch and Dr. Robbie Goldstein. The primary election is September 1. Should I repeat that, September 1, so we all know? Mail-in ballots must be requested 4 business days in advance. However, if I were you, I would do that immediately if you want to vote by mail. Our discussion this evening is co-sponsored by the Walpole Media Corporation and the League of Women Voters of Westwood, Walpole, Dedham. My name is Marcia Hirschberg, a steering committee member of the League. Walpole Media Corporation is a nonprofit, public access cable station operating in Walpole, Massachusetts, whose mission is to give local residents, students, and people who work in Walpole the resources they need to express their opinions, share their talents, or communicate an idea. The League of Women Voters is a nonpartisan political organization that promotes informed and active participation in government. The League does not support nor oppose specific candidates or political parties. It does, however, take positions and advocate for issues that it has studied. Membership in the League is open to all men and women 16 years of age and older. For information, visit lwvwestwoodwalpolededham.org. Tonight's questions have been formulated by League members and are based on League positions. Please be sure that all efforts are made to create a wall between the candidates and League debate planning. This barrier specifically includes no access to debate questions. If you have a concern about this, please do not hesitate to contact the League. When this broadcast is shared, it must be broadcast in its entirety with no edits. I would like to introduce Debbie Winnick, who is a long-term League member from Needham, where she served in many positions. She was president, she was on the she chaired the Civic Action Committee, and she is trained as a League moderator. So at this time, I would like to let Debbie take it away.
Thank you, Marcia. Welcome, candidates. Let me explain the format for our debate. We'll start with an opening statement from each candidate in ballot order, limited to 2 minutes. Then we will pose questions that have been submitted prior to the debate by League members. Questions will be addressed to both candidates. We'll use as many questions as time allows. Each candidate can respond to questions with a limit of 1 minute. Final closing statements will be limited to 1 minute as well. If a candidate exceeds the time limit, I will ask him to stop. Congressman Lynch, your opening statement, please.
Oh, thank you very much.
You have 2 minutes.
Okay, thank you. It's been a huge honor for me to represent the 8th Congressional District over the past 20 years. And I honestly feel that, you know, I was on a call earlier today with Speaker Pelosi and with Steny Hoyer, and it was their opinion, not mine, that this has been the most productive 90 days that the House of Representatives have had in their time in Congress. So not only did we pass the George Floyd Justice and Policing Act, which is just a first step, but it was the bill drafted by John Lewis and the Congressional Black Caucus and people who have been working on that issue for a long, long time. It's just a start, but it's a strong start. And we still have to fight the Senate to get it adopted, but there's more work to be done. The HEROES Act, the CARES Act to address this pandemic that went through and did pass and is currently paying unemployment benefits and providing enormous benefits to people in a very, very difficult situation. The HEROES Act, which has been on the Mitch McConnell's desk for the past 12 weeks, is another bill that we passed. We passed the Surface Transportation Act, which for me personally, I got more legislation of mine in that bill than I have in any time in my time in Congress. The Water Resources Development Act, as a member of the natural, so as a member of the Environmental Committee on Transportation, I was able to have a huge impact on that, on the environmental end, not only in the city of Boston and causing the Army Corps of Engineers to conduct a complete stem to stern study on our climate resiliency, but also getting zero emission buses, $1.7 billion for zero emission buses, but targeted towards places like Brockton that have exhibited disparate health outcomes in respiratory diseases and asthma. It'll provide a significant impact in terms of the health of the Brockton community and other low income and oftentimes minority majority communities all across this country. So those are just some of the things that I've been able to do in the last 90 days. And it has been the result of my seniority in Congress and my ability to make an impact. Thank you.
Thank you. Dr. Goldstein, 2 minutes for an opening statement.
Well, thank you, and good evening to everyone. For those of you who don't know me, I am Dr. Robbie Goldstein. I'm a physician, actually an infectious disease doctor at Mass General Hospital. And I want to start by introducing myself because so many people don't know me out there so far. I grew up in a small town in upstate New York where my dad was a dentist and my mom managed the office. And what they really had was a family business. My sister and I would join them when we weren't in school, and we would watch them care for communities. We'd watch them invest in their neighbors. The work that they did every day inspires me now. I came here 20 years ago to go to college, and I never left. I stayed to get an MD and a PhD, and then went over to MGH to do my training in internal medicine and infectious diseases. And I knew through all of that, I wanted to do what my parents did. I wanted to care for communities, and in particular, those that were most left out. And so I became a primary care doc. I became a doc for folks living with HIV, folks in the LGBTQ community, and people affected by substance use. I got into this race because my patients have told me about their issues with healthcare access repeatedly. But more importantly, they talk to me about food insecurity and housing instability and jobs that pay a living wage and a transportation system that isn't working for them right now. I got into this race because I think those challenges that my patients share with me require a fresh perspective in Washington. Now, I know tonight we're going to hear from the congressman about his record in Washington, and I want to make sure you know mine as well. I want to tell you about the bold leadership and the structural change that I achieved in general as I built the transgender health program. I want to tell you about the years I've spent using data to inform decisions about how to make sure people can live a healthy life. I want to tell you about how I identified gaps in our system, how I built coalitions, and how I drove solutions forward. And I want to use tonight to make sure that this district hears directly from me about how I share your values and how I will lead with those values every single day in Washington. I am looking forward to this conversation. I think it's going to be a lot of fun, and I'm excited to begin.
Thank you. Question number 1 to Congressman Lynch. Do you think the current proposed policing legislation in the House is sufficient? Why or why not?
Well, I do. I actually was involved with the drafting of that bill. The Congressional Black Caucus took the lead. However, we all had input. There were a lot of meetings and video conferencing around that bill. So it actually, when you compare the Senate proposal, the Republican proposal, we outright banned chokeholds. A lot of people are amazed that the chokeholds that were authorized in in Minneapolis, which led to the murder of George Floyd, was actually authorized by their use of force. So we banned chokeholds, we banned no-knock warrants, we changed the policing protocols across the country. And I think that the results of our action, which was supported by John Lewis, which was renamed the George Floyd Justice and Policing Act, was probably one of the proudest accomplishments of this current Congress, and I was happy to support that. Thank you.
Dr. Goldstein, same question. You have 1 minute.
Thank you for the question. And certainly I think that the George Floyd Justice and Policing Act was a monumental step forward when it comes to police reform in this country. But really, it seems to be just just the bare minimum of what we need to do in this country. It's certainly not enough. We need to move forward to end qualified immunity at the federal level and certainly in every state. There are a number of bills that are coming out of this House, many of which the Congressman has not yet sponsored or co-sponsored, that would really address some of these issues, including qualified immunity, including making sure that people have access to the medical care they need while they're being detained. I think that there is a much broader conversation that we have to have, though, beyond just our criminal justice system, or as I say, criminal legal system. I think we have to recognize the racism that exists in every aspect of our society. And until we intentionally and explicitly include an anti-racism piece into every bill, we'll never actually be able to address what is going on in the police force with police brutality, the racism that we see in the criminal legal system.
Now we're going to go to the next question. Dr. Goldstein, you're up first. You have a minute. The question is, in light of the current pandemic, is the Affordable Care Act adequate for the health of Americans? Why or why not?
Well, the Affordable Care Act back in 2010 was a monumental piece of legislation, the largest expansion of healthcare since Medicare and Medicaid. And I'll note that it is a bill that the Congressman voted against back in 2010. I certainly think it put us on the right direction, but having worked in the broken system, having been in the ICU, facing all of those patients, living with, suffering through COVID, I know that it's not enough. We need to move forward and address access, cost, and equity in our healthcare system. And the only way that we can do that is to move towards a single payer.
30 seconds.
Now, single payer is not going to happen overnight. We have a lot of work that we need to do, and some of that work can be done right now with the Congress that is sitting in Washington. That's expanding Medicaid in all 50 states. That's lowering the age for people to get on Medicare. That's giving people the ability to buy in to the exchange after they lost their job due to COVID. We have a tremendous amount of work, but the direction that we need to go to is increase access, controlling costs, and improving equity in our system.
Thank you. Congressman Lynch, the same question, 1 minute, please.
Sure, great. I'm very proud to say that the state of the Affordable Care Act today is much better than when it passed back in 2010. The three big problems with the Affordable Care Act and the reasons that I voted against the Senate version, remember, I supported the House version of the Affordable Care Act, voted against the Senate version. Number one, it taxed union healthcare plans. So all the people like my mom and dad and my co-workers, I was an iron worker for 20 years, we stood on a picket line to get good healthcare. And the Affordable Care Act actually penalized us for doing that. That was one problem. Number two, it gave the insurance companies an antitrust exemption. That was a huge problem because it worked against competition. And number three, it took out the public option. So I've been working to put back the public option to restore this Affordable Care Act to what it originally was intended. And my opponent is looking to rip out the ACA root and branch and now go to a completely different model. We ought to improve and save the Affordable Care Act, not get rid of it. And that's what I'm doing. Thank you.
Thank you. Congressman Lynch, 1 minute. Do you support the new Green Deal? Why or why not?
Sure, I support. I'm an original co-sponsor of the new Green Deal. However, it doesn't really do anything. It's a sense of Congress resolution, right? It says Congress believes in this. And if you read through it, it says in multiple places, it says, as technology allows. So it sort of, it gives an impression of action, but not really requiring it. I actually sponsored a bill, a climate change,
30 seconds.
A whole of government climate change responsibility act, which requires each and every federal agency to, in their budget, devote money towards climate change resiliency. That means the Defense Department, the Transportation Department, the Education Department must all spend money on identifying and addressing the climate change impacts on their particular federal department. Over the next 10 years, that will bring billions of dollars to fight climate change and make people more aware of that threat.
Thank you. Thank you. Dr. Goldstein, the same question, 1 minute.
So I certainly support the Green New Deal. I think it is an amazing package, as the Congressman said, a resolution that ties together environmental justice with racial justice and healthcare, understanding transportation, and so many things that are linked to our environmental policy. I will say that for me and for so many people my age and my generation, this is the fight of our generation. This is the fight of our lifetime. We recognize, and I recognize, the urgency of dealing with the climate crisis. Congressman Lynch has previously been quoted as saying that he thinks this is an elitist issue that we can deal with in 40 to 50 years.
30 seconds.
And I see this as an urgent crisis that must be dealt with in the next 5 to 10 years. Certainly, again, this is something that the current Congress should be pushing forward with every single day. And I hope in January 2021, it can be one of the first bills that I support, one of the first pieces of legislation that we can push forward to really address this urgent crisis that's facing our globe and certainly our country.
Thank you very much. Next question. Dr. Goldstein, you're up first on this one. What should be in a new coronavirus economic mitigation package?
I think we have to recognize that the CARES Act and the HEROES Act were certainly the necessary, they weren't sufficient, that they weren't everything that we needed in order to move forward and to bring people out of this pandemic. We need emergency cash relief all across this country so that people can put food on the table, can pay their rents, can make sure that they can get their kids into daycare. We need to talk about daycare and universal childcare and pre-K access so that can be a part of this process. As people go back to work, they have a place for their children to go to learn and to grow. We need to make sure that we are also investing in the healthcare space. As I said before, I was in the ICU fighting against this virus. I know how challenging it is to make sure that we have enough PPE and that we have the right training, we have the right professionals there to make sure that they're taking care of everyone. There is so much work to be done, and it is urgent that we move forward with it now. As we saw just last week, that $600 that people were getting extra from their unemployment benefits went away. We've got to make sure that every single day we're fighting to move forward.
Thank you. Congressman Lynch, the same question, 1 minute.
Okay. First of all, I want to address what my opponent is trying to put words in my mouth. I never said that climate change was an elitist issue. Okay. Since we don't have such short time, I would just, anybody who's watching this, if you go to govtrack.us, my League of Conservation Voters, the most powerful environmental group in this country and the most resilient, has rated me as a 94% record on League of Conservation Voter issues. What I believe the coronavirus bill should be is in the HEROES Act. And if you go to stephenlynch.com, you'll find a description of that. I was a co-sponsor and also supported the bill. It has a lot in there. It deals with unemployment issues. It deals with aid to the cities and states. It also deals with personal payment for unemployment benefits and stimulus. Thank you.
Thank you. We do need to move on. Congressman Lynch, next question. What is happening in the House about asylum seekers, dreamers, and refugees? What do you think should be done?
Well, we have in the HEROES Act, we have actually allocated money to the states that are currently paying for the care and protection of many of the children that have come in and who are right now in state custody, and also other programs varying by state. So we've put billions in there to allow those people to receive the benefits and the support that they've received. The other big issue we're fighting right now on this is the census. So President Trump has given the U.S. Census Department instructions not to count undocumented immigrants. So that's a huge issue. We had a meeting on that today. I had a meeting this morning with Bill Galvin, our Secretary of State here in the Commonwealth of Massachusetts, to try to address the fact that so many of our cities and towns are undercounted, and we're trying to work on that issue right now. So that goes for all cities in the Commonwealth, but we're desperately undercounted at this point in the census, and we need the resources to help those people within our state and all across the country.
Thank you. Dr. Goldstein, the same question. Asylum seekers, dreamers, refugees.
You know, I obviously have a very personal connection to this. So many of my patients are undocumented. So many of my patients have come to this country seeking asylum, seeking a safe place. You know, it's interesting to hear the congressman talk about his opposition to President Trump because he did vote with the president to build a wall across our southern border and to increase funding to ICE and CBP. And also in a vote that I can't truly comprehend, a vote for Kate's Law, which is really a xenophobic and Republican bill that only serves to further isolate those that are seeking asylum in this country. I see this as not a law enforcement crisis,
30 seconds.
Not a border patrol crisis. I see this as a humanitarian crisis and a healthcare crisis. And I think our answer is to make sure that we have the right experts, the right expertise on our southern border and all across this country, dealing with those who are seeking asylum, the legal process as people flee persecution, violence, and prejudice in their home country. I think we should be welcoming them, we should be affirming them, we should make sure they have all of the resources that they need when they get here.
Thank you. We are about halfway through our questions. I'd like to offer you each a minute now to pick a topic that we've addressed already and discuss it a little bit further. Your choice. Dr. Goldstein.
Well, you know, I think I'll go back to our conversation around healthcare because I just want to correct the record a little bit, Congressman. You did not speak about a national public option in 2010. It wasn't until 2013 when you began to have that conversation. And I'll point out that all of the other members of the Congressional Labor and Working Families Caucus that you lead did vote for the ACA and didn't have those concerns around labor. What is really true in that vote is that the House bill included an anti-choice amendment, the Stupak-Pitts amendment, limiting access to abortion, and you voted against a version that didn't have that abortion restriction in it. And so I think we just need to be very clear that I am a physician, I am in the healthcare space, I am fighting at all times for increased access to healthcare, making sure people have what they need. The Affordable Care Act was an enormous step forward in doing that, and something that we should all celebrate and make sure that we are all supportive of. The push for single payer is just the next step in that direction.
Thank you. Congressman Lynch, topic of your choice for 1 minute, please.
Sure. Let me just clear out a couple of things. Number one, I did not vote to support the wall and support President Trump. I've gone down to the border on multiple occasions to meet with people that are being confronted and you know, children being mistreated. So I've been down there with my my Democratic colleagues and Republican colleagues to look at the situation down there. Let me also correct the incorrect information regarding the national public option. So the original public option that we had in our bill that they took out was a state-sponsored public option, because otherwise a national public option would force Massachusetts to reconcile their healthcare standards with Mississippi, Arkansas, and others. They weren't going to raise them to our level. They were going to lower our, you know, superior healthcare down to the lower level. So that was the reason that I insisted at that time.
1 minute.
I had a lot of statements on that. The reproductive rights. Oh, I thought you said 1 minute. No.
I think she said that 1 minute was up.
Oh, okay. All right.
Sorry. Okay. Next question.
Okay. Thank you.
Congressman Lynch, this one's yours. First, what gun safety measures do you support?
Okay, so we have a gun control, responsible gun control coalition. We have a 4-bill package that I have supported consistently. One of them was to outlaw high-capacity magazines, also to have a comprehensive background check. There are too many loopholes that allow dealers to sell high-capacity weapons and other weapons across state borders. There's also there are 2 other elements of, anybody on the no-fly list should not be able to purchase a firearm. And there's one more, and I'm forgetting what the other 4, the 4th bill of that package is. But I've supported that consistently over the last 10 years. So that's where I am. Thanks.
Thank you very much. Dr. Goldstein, what gun safety measures do you support?
Well, I'll first start by saying that this is my lane. I am a physician who sees people who are the victims of gun violence every day. I see them in the emergency room. I see them in the hospital. I see them in my clinic. And I know that we can, as a country, move forward with common sense gun violence prevention measures. That certainly includes some of the things the congressman talked about, universal background checks. I would include closing the boyfriend loophole, passing the Violence Against Women Act. I would also talk about making sure that we're holding gun manufacturers liable for those mass shootings that are happening all across this country. But we also have to recognize that the gun violence epidemic that exists in this country, and certainly is continuing through the COVID-19 pandemic, is an epidemic that affects our country differently. There are certainly the mass shootings that are in the news, but the majority of gun violence is coming from either suicide or on the streets in communities of color. And what we need to do is invest in those programs that are supporting the survivors of gun violence, those programs that are supporting the mental health of people who may have access to a gun, and making sure that they have everything they need so that they can both survive the violence that may occur and thrive afterwards.
Thank you very much. Dr. Goldstein, how should Congress reverse the reduction of environmental regulations?
Well, there's so much to do in January 2021, hopefully with a President Biden, a Democratic Senate, and further control of the House, where we can really begin to put back so much of what has been dismantled. We obviously need to make sure that our regulations are pushing us in the right direction, going back to the Green New Deal for sure, thinking about shifting from a fossil fuel economy that is only worsening this crisis to a renewable energy economy, making sure that we have regulations in place that hold people accountable to efficiency standards so that the affordable housing that is being built all across this country is efficient. And also making sure that we are investing in the adaptation that is necessary to deal with the inevitable complications of climate change. What this current administration has not recognized, or at least has not acknowledged, is that we will see 1 to 2 meters of sea level rise in the next 40 to 50 years. We will see an increase in global temperatures no matter what we do, and we must be prepared. Those regulations that were peeled back, they were our ability to be prepared for what is coming, and we've got to make sure that we adapt and get ready for those complications.
Thank you. Congressman Lynch.
Sure. Again, this is going back to the environment, is that right?
Yes, I'm sorry.
Give me the question again.
How should Congress reverse the reduction of environmental regulations?
Okay, so one of the ways to do that, of course, President Obama put a lot of those protections in on emissions and otherwise, and now because they were only presidential directives, they have been undone, many of them, hundreds of them by President Trump. So what we are doing now in the surface transportation bill that we just passed, and I'm on that committee, so I got a lot of amendments there, is put them into law. So we require in rebuilding our surface transportation that we do as much green infrastructure as we possibly can. Make sure that we have green technology, recharging stations, green buses instead of these old diesel buses that we see being used. I put in resources for the seawalls up and down from all the way from the north end all the way down to Situate in the Water Resources Development Act. We even put in a study with the Army Corps of Engineers to give us an assessment, in the city of Boston on our climate change resiliency. Thank you.
Thank you. Congressman Lynch, housing concerns were present before the pandemic. What do you propose to address the short and long-term housing needs?
Well, I've been on the housing committee before in its larger version. So right now in the HEROES Act, we continue the forbearance. This is the short term. So in the CARES Act, we said to everyone, look, tenants, we're going to freeze any rent that is due because of the people getting thrown out of jobs. But we also said to landlords, we're gonna hold you harmless as well from your creditors. And we held
30 seconds.
Mortgage companies harmless, and that has frozen the status quo for right now. However, that expires in July. So July 31st, it actually expired yesterday. So what we're trying to do in the HEROES Act is extend that till January 1st and then see what the situation is. But that would take a lot of pressure off of housing. We've also pumped in billions of dollars to provide more public housing.
Thank you. Dr. Goldstein, housing concerns were present before the pandemic. What do you propose to address the short and long-term needs?
Well, certainly the eviction moratorium that the congressman is talking about is incredibly important to make sure that people can stay in their homes during this crisis. I also, as I mentioned earlier, I'm in full support of emergency cash relief to make sure that those people who can pay for their rent actually have the money to pay for their rent. In the long term, we have so much more work to do. And I think of this as the federal government really has, for the past few decades, been operating with its hands tied behind its back. The Faircloth Amendment, which was just repealed in the House in a vote, was an enormous step forward, that repeal, to make sure that the federal government can fund appropriately affordable housing all across this country. It is also connected to our environmental issues, and we have to make sure that those houses that are being built are efficient, that they are part of our process of moving forward with environmental justice. And it's also connected with racial justice. We have to make sure that home ownership is not out of reach for Black and brown communities all across this country. There's a lot for the federal government to do. They need to be able to remove the handcuffs and push forward. And that's going to take working with a lot of the regulation that currently exists and repealing much of what the Republicans have passed.
Thank you. Dr. Goldstein, how do you propose that we reduce the sale and use of disposable products and packaging?
So, there are some great examples of this, right? There are taxes that we can place on the use of a plastic bag or the use of plastic utensils at a restaurant or at a store all across the country. Now, obviously, we've run into some issues in the setting of COVID, and as an infectious disease doc, I recognize that we had to put people's public safety ahead of that for right now. But I hope we can go back to a period and to a place where we are actually encouraging people to use reusable bags, encouraging people to bring their own utensils and straws, encouraging people to make sure that we are decreasing our overall waste. There are ways that we can incentivize this through the federal government, through the state governments, and through the municipal governments. I think we have to work in a coordinated way so that we here in Massachusetts aren't just doing all the work. The entire country is following us in our lead and our ability to push forward with these regulations.
Thank you. Congressman Lynch, same question, please.
Wait, give me that question again. I'm sorry.
Certainly. How do you propose that we reduce the sale and use of disposable products and packaging?
Well, I actually think we do a pretty good job in Massachusetts, but it's largely been driven by folks like MassPerg and others that have raised the consciousness of the environmental impacts there. So I'm very proud of our mayors. The mayors in our district have done a very good job in terms of, banning the use of plastic bags. And again, that's been rolled back somewhat because of, they don't want you reusing your personal bags at the market anymore because of the COVID. But
30 seconds.
I think that tax policy really does guide this. So you can incentivize those who limit the amount of packaging that they have, and also vote with your feet in terms of buying those products that are packaged more responsibly environmentally. It's an area where I think Massachusetts has been one of the leaders. I think California is trying their best as well, but we need to do much more in this area.
Thank you. We are going to have another chance for candidate's choice. Any topic that you would like to speak to for 1 minute, please. Whether it be previous topic that you'd like to rebut a statement or take on something new. 1 minute. Congressman Lynch.
Thank you so much. I would like to revisit the issue of public housing. I'm one of the only members of Congress who actually grew up in the housing projects. Grew up there with my mom and dad and my 5 sisters. Very, very humble beginnings. There were times when my dad said we had to save up to be poor. We grew up in the old colony housing projects. I'm very proud to say, my mom was instrumental in getting the library started there. There was never a library. It was actually old defense housing. My mom got the library started, and Mayor Walsh was kind enough to rename the housing projects where I grew up, the Ann Lynch Homes at Old Colony, one of the proudest moments of my life. I've also obtained about $50 million to redo that entire housing project so that the kids growing up there, I used to represent people in public housing when I was attorney. I would represent people who had lead paint on their windows, that had asbestos in their pipes. That's how I got involved in politics. I started representing families in public housing. And thank you.
Thank you. Dr. Goldstein.
No, I think I'd like to go back to our COVID response, because I think we could not possibly spend enough time on COVID, seeing as it is affecting our nation in so many ways. I mean, there are 20 million Americans that are out of work. There are 5.4 million Americans who lost their insurance because they lost their job in the setting of COVID. Certainly, we know there are 5 million Americans infected, and tragically 150,000 or more that have died from this virus. I think we also have to think about how we got to this place, how we got to a point where a virus could spread across this country. And we got here because we lacked the public health infrastructure that is so urgently needed in this country to prepare ourselves. That is a public health infrastructure that was actually laid out in the Affordable Care Act. It's a public health infrastructure that was stripped away, all of the funding over the past 10 years, with very little oversight from Congress on that, as Republicans, first in the House, but then certainly in the presidency, have pulled away that funding. That lack of oversight, that lack of public health infrastructure has left us in a place where the virus has spread so quickly. And I think we need to make sure as we build our recovery that we're building that infrastructure back.
Thank you. Dr. Goldstein, what measures would you propose to strengthen mass transit?
You know, when I think about our transportation system, it is more than just our mass transit, although that is such a crucial and huge piece of it. Our transportation system starts incredibly locally in terms of expanding sidewalks, building bike lanes, making sure that people aren't dependent on their cars for short distances. It certainly includes investing in our mass transit systems, our buses, but also our high-speed rail and regional rail, so that people can get to and from where they need to go. You know, in this district, it can take over 90 minutes to go from Boston to Brockton, which is about a 35-mile distance. And that could be solved with an investment in mass transit. But we also have to look to the skies and recognize that we've incentivized airplanes in many ways in this country and have disincentivized using mass transit. And so when we can begin to shift that balance, we can make sure there's high-speed rail between Boston and New York, as opposed to taking a plane that might take off from Logan 3, 4, 5, 6 times an hour simply to travel that short distance. So we've got to change our incentives so that we are making sure we're building the mass transit system.
Thank you. Congressman Lynch, what measures would you propose to strengthen mass transit?
Well, we just allocated $1.5 trillion to the surface transportation needs of this country. And, you know, in every single instance where we could include provisions that require a greener infrastructure, we have done so. So that includes the MBTA, that includes commuter rail. The amendments that I personally got in the transportation bill, one was for requiring the Department of Transportation to, every 2 years, do an analysis of the pedestrian and bicyclist accidents around this country, because most of them occur at the same intersection. So holding them responsible. Again, zero emission buses, $1.7 billion. We'll be able to expand that program. We have 64,000 bridges in the United States that are structurally deficient right now. I'm on the Aviation Committee. I'm on the Pipelines and Hazardous Materials Committee. I'm also on the Environment Committee on Transportation. So I've had a unique opportunity to make an impact in all those areas. Thank you.
Thank you. Thank you. Congressman Lynch, what do you believe is your #1 strength?
My #1 strength is actually my perspective. I'm the only iron worker. So I strapped on a pair of work boots for 20 years. And as I said before, I grew up in public housing. There's nobody in Congress that brings that perspective. We get a lot of doctors. There's probably 30 doctors. Their mom and dad were doctors, they're doctors. That doesn't bring a diverse perspective at all. I'm the only iron worker in Congress, very proud of that fact. Very few of them have actually worked extensively, you know, on a construction site and are able to bring that perspective. So I think in each and every opportunity, look, my responsibility is to bring the perspective of the people that I represent. And I think I do that extremely well. And, you know, I was one of the very few that voted against the bank bailout, where they took tax money from people who didn't even have bank accounts and gave it to the banks. I think I think that reflects on who I am and the perspective that I bring to Congress. Thank you.
Thank you very much. Dr. Goldstein, what do you believe is your number one strength?
Well, I actually think being a physician is an incredible strength. And I'll point out to the congressman, there are actually only 17 physicians in the current Congress, 14 of which are Republicans, and there's no infectious disease doctor in the sitting Congress right now. I think that experience of preparing every single day for a pandemic might give me a very unique perspective in Washington and how we can move forward from the COVID-19 crisis. But more importantly, the training that I've received in how to understand data, how to use data to drive decisions, how to use data to make sure that people can actually live a healthy life every single day. Now, that is the perspective of being a physician. And I think more so, being a physician means that I sit in a room every single day with individuals and I talk to them about all aspects of their life. I hear their stories and their challenges. I hear from them what it is they need from our government. I will bring those stories with me every day to Washington. Those are the stories that will drive the policy I write. They are the stories that will drive the votes that I take. They are the stories that matter all across this district. So I think the perspective that I bring as a physician is incredibly unique and important.
Thank you. Thank you. We have time for 2 more questions, then we're going to go into closing statements. So here's the last question. The second to last question, I'm sorry. Dr. Goldstein, what's your number one priority if elected?
Certainly, we have to recognize that in January 2021, we will still be dealing with the COVID-19 crisis. And so the number one priority is to make sure that every person in this country can be healthy and safe and protected through the crisis. Now, that is going to take a lot of different paths forward. We're going to need to continue to push forward with relief bills. We're going to have to move forward with universal healthcare access and moving towards that single payer system. As I talked about, we can immediately expand Medicaid in all 50 states and lower the age to get onto Medicare, reopen the exchanges. And we also have to have the other conversations. We can walk and chew gum at the same time. We can make sure that we're moving forward with environmental justice, that we are including a racial equity lens in every bill that comes out of Congress, that we are talking about our infrastructure, and that we're building back to the place we were under the Obama administration. We can do all of that as we rebuild from the COVID-19 crisis. And I'll say just one last thing, which is that shame on us if we go back to what we had before COVID in January of 2020. We can build something much better and something much stronger as a nation.
Thank you. Congressman Lynch.
Repeat that again, I'm sorry.
If re-elected, what is your number one priority?
Okay, so I think there are 3 priorities that are sort of meshed together here. One, we're in a moment right now on racial equality in this country that we have to seize upon right now, regardless of everything else that's going on. This is a moment in history, and shame on us if we lose this opportunity to further the cause of racial equity in this country. We do it amidst of COVID-19, as the doctor mentioned, and that creates greater difficulty. But the third issue as well, and of course we got to take care of the health aspects of that. But the third thing that we have upon us right now is this election, and we have a president that's trying to suppress something that's near and dear to the League of Women Voters, the turnout in this upcoming election. I voted for 4 separate funding bills to make sure that every American has the right to vote. And, we're fighting tooth and nail with the president right now because the vote by mail is going to have to be conducted by the post office, and he refuses to allow that funding to go through. Thank you.
Thank you. The last question, Congressman Lynch, to you first. Is there an area that we haven't covered that you would like to speak to?
You've certainly covered a lot. I think that, the issue of Black Lives Matter, I've had an opportunity to attend about 11 of those vigils or marches or other events. And I think that if there's one historic moment that we are in right now, it is a moment to try to move the country forward on racial equity. I give great credit to the young people who have come out. They are the new abolitionists. People don't realize how few people stood up against slavery. It was a small group of people, and I think our young people here today are the new abolitionists. And I think that I think that is the one issue that deserves further discussion, and I appreciate it. It's a 1-minute format. It doesn't allow us to do justice to issues, momentous issues like that. But you know, I really do think that those bills and those initiatives that we can further will help us in the long run. Thank you.
Thank you. Thank you. Dr. Goldstein, an issue that we haven't touched upon.
You know, I think I have so many that we could talk about, but I would like to spend this time to talk about reproductive justice, because I think it's incredibly important to me and to the voters of this district. We saw just at the end of June how precarious reproductive justice is in this country. The June medical decision seemed like a monumental step forward from the Supreme Court protecting Roe, although it really left us quite open to a future Supreme Court decision pushing back against Roe. And I think we need to make sure that we have legislators in Washington who will fight every day for the legislation of Roe, to make sure that abortion is protected and legal in all 50 states. That it doesn't matter whether you are Black, brown, or white in this country, you can access reproductive health care. That it doesn't matter if you live in a city or if you live in a rural area, you can access reproductive health care. Because at its core, reproductive justice is about making sure that everybody, every single person in this country can live a healthy life. And I, as someone who firmly believes in a woman's right to choose and firmly believes that everyone should be able to choose when, how, and where to have a family, that we need to make sure we have legislators in Washington that are pushing forward with that issue.
Thank you. Thank you to both candidates for your willingness to participate in our forum. We wish you both good luck with the election, and thank you to our audience, our YouTube audience. We will now finish with closing statements in the reverse order of opening statements, starting with Dr. Goldstein. You have 1 minute.
Well, thank you, Debbie, for moderating. Thank you, Congressman Lynch, for being a part of the conversation tonight. I hope we have more. And I hope that everyone was able to hear the differences between us tonight, and that folks can make a more informed decision about who to vote for on or before September 1st. I have been saying since the beginning of this campaign that I'm in this fight to make sure that everyone has access, equity, and opportunity. Every person in every community across the district. And I think my answers tonight and my vision for leadership show just that. Tonight was the start of a conversation.
30 seconds.
A conversation about how we fix our broken healthcare system, about how we come together and get through COVID-19, about how we address structural racism and institutional misogyny in all aspects of our society. It was just the start of that conversation. My promise to you is to keep talking, to keep this conversation going, and I will always be here to listen, to learn, and to lift you up. I'm proud of this campaign, the message and the mission, because it reflects all of you. I know that it reflects the issues that matter most. So I hope you agree, and I hope that you'll vote for me on or before September 1st. Thanks for watching, and everyone have a good night.
Thank you. Congressman Lynch, your closing statement, 1 minute, please.
Thank you very much. First of all, I want to thank Dr. Goldstein for participating as well, and thank the League of Women Voters. So because of the format and frankly, because of time limits, it's very difficult to understand the scope of the work I've done over the last 20 years. So I would just, again, look, different groups, you know, the Human Rights Campaign, the most powerful and I would say relentless LGBTQ group in the country, has endorsed me. Go to their website and look at my voting record over the last 20 years. The League of Conservation Voters, my track record is on their website. So if you go to govtrack, govtrack.us, you can go to the website. You can actually look at the record that I've established over the last 20 years. Yeah, I'm enormously proud to represent this district, and I ask you for your vote so that I can continue to do that in the United States Congress. These are very challenging times. Thank you.
They are, and thank you both. Remember, the primary election is September 1st. The deadline to register to vote for this election is August 22nd. In addition to in-person voting on Election Day, vote by mail ballots may be requested through August 26th. If you select this option, please make sure you allow enough time for your request to be processed, for the ballot to be received and then returned by Election Day. In-person early voting is August 22nd through August 28th. Visit the Massachusetts Secretary of the Commonwealth website for details. On behalf of the League of Women Voters, thank you very much for watching.